We all take care of our physical health. Whenever we get sick, we go to a doctor. Whenever we are physically hurt, others help us. That's terrific. But how many of us prioritize our mental health? How many of us turn to our friends or a psychologist when we are feeling down? Or how many of us inquire about the well-being of a friend?
Are you okay?
No.
Because today is World Mental Health Day. Hey folks, how are you doing today? Today we will talk about our health, our mental health. We will discuss the importance of mental health, the various issues it faces, and how we can improve it collectively as a society. But first, let's have a look at its history. For millennia, mental health has been a matter of discussion and study. Psychiatric treatments were first described in Mesopotamia, when mental diseases were thought to be caused by supernatural creatures. Treatments included exorcisms, sacrifices, prayers, use of natural herbs and potions, and if nothing worked, a trip to the asylum, which at the same time was basically a torture chamber. In ancient Greece, this thought changed a bit, when the renowned Greek physician Hippocrates proposed that actually it is our brain that is responsible for emotional imbalances, and it should be treated as equally as we treat a physical body. This notion gave rise to the humoral theory of mental health, which proposed that mental health was based on the balance of four humors: black bile, yellow bile, phlegm, and blood. Treatments were then proposed which included dietary adjustments, lifestyle changes, and physical interventions, such as bloodletting. A greater emphasis on understanding the psychological origins of mental illness came during the 18th century. During this time, the term madness was coined, which was basically used to characterize a variety of mental health conditions. By the 19th century, the development of many modern treatments for mental health issues had begun. This period also saw the emergence of moral treatments, which emphasized on understanding the patient's predicament and constantly offering a supporting setting. The 20th century saw further advances in mental health awareness and treatment, which led to the invention of drugs to address mental health disorders, as well as the rise of psychosurgery, electroconvulsive therapy, and other forms of mental health care. This century also witnessed the establishment of the first psychiatric hospitals, as well as the creation of the Diagnostic and Statistical Manual of Mental Disorders, DSM. By the time we reached the 21st century, we had amassed a huge understanding why mental health issues occur, and hence nowadays there is a greater emphasis on preventive care and early intervention. Mental health treatments have become more accessible, and there is greater focus on understanding the social, economic, and cultural factors that can lead to mental health decline. But still, there seems to be something missing. We now know more than ever, then what could it be? It's actually the lack of awareness, and also a lot of ignorance. World Mental Health Day started in 1992 as an awareness program, and since then it has played an important role in highlighting various mental health issues every year all around the world. The initiative had such an impact that Prime Minister Theresa May named Jackie Doyle Price as the UK's first suicide prevention minister on World Mental Health Day in 2018. This was a huge step as it gave the government a dedicated responsibility to curb mental health issues, some that they have avoided doing for a long time. And these types of steps are necessary now more than ever, because mental health conditions are increasing in staggering fashion. I mean, just look at these numbers noted by National Alliance on Mental Illness. 1 in 5 US adults experience mental illness each year. 1 in 20 US adults experience serious mental illnesses each year. 1 in 6 US youth aged 6 to 17 experience a mental health disorder each year. Suicide is the second leading cause of death among people aged 10 to 14. The numbers are not at all good, and to prevent it from increasing, the global community will have to keep investing in promoting mental health and well-being, providing early intervention and evidence-based treatment, and ensuring access to quality mental health care. And we have to do this as soon as possible. Did you pay attention to those numbers we just mentioned? Look closely. Did you see? Mental health is eating away our next generation. The Centers for Disease Control and Prevention, CDC, estimates that 1 in every 6 children aged 2 to 8 years has a mental, behavioral, or developmental disability. The CDC also adds that this figure has risen since the 1960s, that the rate of mental health problems among children is growing faster than that of adults. According to the 2017 National Survey of Children's Health, approximately 10.7 million children aged 2 to 17 have some form of mental health disorder. In the United States only, it is estimated that the attention deficit hyperactivity disorder, or ADHD, a neurological disorder, affects 6.1 million children. Anxiety affects around 4.4 million children. Depression is estimated to affect 3.2 million children, and autism spectrum disorder, ASD, affects 1.5 million children in the US. Collectively, this is equivalent to 1 in every 5 children in the United States. The causes of children's mental health disorders are complicated and frequently unknown. Genetics, environmental effects, and brain chemistry have all been suggested as possible contributors. It could also be because of the rate at which our lifestyles have altered as a result of technology advancements, although the reasons are not conclusive. Our efforts to resolve this issue should be. There are numerous techniques to addressing and managing children's mental health difficulties. These include psychotherapy, medication, lifestyle changes, and family or group therapy. There are also a number of programs and resources available to assist families with children who are experiencing mental health issues. It is critical to remember that mental health issues can be successfully managed with the correct therapy. Parents and caregivers must also support and understand their children, as well as seek professional help when necessary. Children's mental health disorders can benefit from early diagnosis and treatment, which can reduce the severity of their symptoms and improve their attitude. What we failed to understand before should not be misunderstood now. Mental health is not a taboo. Mental health is very important for us today and our future generation tomorrow. If you liked the video, hit the like button and subscribe to our channel Behind the Date. Stay tuned.